Peter Gusky with the Back Saver System. I'm here today to talk about correct lifting, or how to lift correctly in order to avoid back pain, in order to avoid a back injury. I can't imagine an area of physical therapy and rehabilitation where there is more misinformation and conflicting information concerning how to lift correctly, how to pick things up in order to make sure that you don't hurt your back. I've had so many patients tell me over the years that they hurt their back while bending or picking something up. They usually make mention of the fact that it wasn't very heavy, but they always also mention to me that they thought they were lifting correctly. In other words, they've been trying to do it or believed that they were doing it correctly in the way that their physical therapist had explained to them how to do it in order to avoid back pain, but nevertheless, again, their back goes out, they've hurt themselves. So there's a tremendous amount of confusion about this with lower back pain patients. The whole idea, the whole concept that's missing here, the whole point concerning lifting correctly in order to avoid back pain, the most effective tool that we have is keeping the lower back arched inward. And this must be done to the maximum degree that you can possibly manage while lifting. Now, there are many physical therapists out there, other healthcare professionals, that will tell you that when you lift correctly, in order to lift correctly, to make sure that you don't have back pain, you don't want to lift with your back arched into the extreme, and you don't want to lift with your back arched out either. That instead you should be somewhere in the middle, or what's sometimes referred to as the neutral spine position. Kind of walk the middle of the road. Don't have your back arched in too much and don't have it arched out too much. Kind of split the difference, so to speak. It is this kind of information, it is this kind of instruction to kind of have your back somewhere in the middle, in the neutral spine position. It's that kind of teaching that, in my strong opinion, is the reason why so many people re-injure their backs. The best way to prevent an injury, to make sure that you don't have back pain while lifting or picking something up, is to keep your lower back arched in to the maximum degree that you can possibly manage. Now, there are many people that will tell you that one of the worst ways to lift something or pick something up is with your knees and hips straight. You bend over in this position, cantilever. They'll tell you this is bad. It's a sure way to obtain a back injury. And indeed, that's true. But they'll tell you instead to bend your knees or squat down when you lift something. Bend those knees. This is emphasized over and over again by people who will try to teach you the correct way to lift. Although bending your knees and squatting down is indeed important in order to avoid a back injury, that kind of instruction misses the point. The whole idea, in order to avoid a back injury, or in order to make sure that you don't hurt your lower back while lifting, is to keep your lower back arched in to the maximum degree that you can possibly manage. That's partly because as you squat down, as you begin to bend your knees to lift something, especially if it's very low down to the ground, as you do that, your hip musculature, your lower back musculature, the tendon and ligamentous structure in your hips and lower backs, and this is especially true if you happen to be over the age of 25, and of course I'm well beyond double that age. As you begin to age and you try to squat down or get down to something in order to pick it up, all of the musculature and tendinous and ligamentous structures in your hips and lower back will try to force you into the arched out position. It will be all that you can do to try to keep your lower back arched in to the maximum degree that you can possibly maintain it in order to avoid a back injury. So all of your efforts while lifting, and this becomes second nature after a while, all of your efforts need to be placed into simply trying to keep your lower back arched in as much as possible. And I'll demonstrate this here in just a moment, correct lifting with this Olympic bar that I have placed all the way down the ground in order to make it as difficult as possible, in order to make this a real demonstration. A standard Olympic bar weighs 45 pounds, by the way. when you try to lift correctly in this manner, as I said, and I can't emphasize it often enough, try to keep your lower back arched inward. The problem with trying to keep your lower back arched inward while you're also squatting down is that many people simply don't have the flexibility in their lower backs to even get into the arched in position, let alone maintain it while lifting. Additionally, the reason many people can't squat down and don't lift correctly is because they have pain in their knees or lack of flexibility in their knees, which simply makes it very difficult or painful for them to squat at all. If you have difficulty, pains in your knees or lower back, or lack of flexibility, there are 2 separate videos on our website which will dramatically decrease knee pain, increase knee flexibility, and also assist you in increasing your range of motion or flexibility into the arched in position of your lower back so that you can have the flexibility to even get into the position that I'm about to demonstrate is correct lifting. It should be noted, by the way, that this emphasis on keeping the lower back arched in to the maximum possible degree that you can manage in order to avoid lower back pain while lifting something. This idea, this very effective concept, has been known by weightlifters and bodybuilders for years. But in the medical community in general, and in particular physical therapists, have long had a bias against accepting anything that weightlifters or bodybuilders utilize, any ideas that they utilize that might be related to rehabilitation. That's for a number of reasons, and it's cultural. I won't go into that now, but we ignore these concepts that weightlifters and bodybuilders have used for years in order to avoid back injuries while lifting. We ignore this at our peril. Weightlifters and bodybuilders have used the idea of keeping the lower back arched in to the maximum degree that they can possibly manage while lifting an object. They've been using that for years, and I would say generations, very effectively to avoid back injuries. Here's the way it works. You get as close to the object as possible, as you're told by many people. You then begin to squat down, and keep in mind, as you do so, everything in your body is going to be working to arch your lower back out. Don't give in to that. Try to keep your lower back arched in as much as possible. And again, that's more difficult to do the lower you get. Grasp the object, and then keeping your lower back arched in, go to the upright position. That's ideal, perfect lifting. I can tell you right now, it will not be possible in many work situations. You do the best you can. Again, keeping in mind the primary and overriding concern, which is keeping your lower back arched in. Same way when you lower it down, keep your lower back arched in and return the object to the starting position. Again, all the while, trying to keep your lower back arched in as much as possible. That should be your overriding concern if you want to lift correctly and avoid lower back pain.